Okay, this video is called Does Abortion Increase Breast Cancer Risk? And here's the first paper we'll talk about. For women who had abortion, 1,451, that's a lot of patients. It increased breast cancer risk by 90%, okay? An induced abortion, all right? That's a lot, 90% in this particular paper with a big number of patients studied. Okay, here's the next paper. And you're welcome to look these all up yourself. They're right here. Here's the paper. You can look it up yourself. Okay, risk of breast cancer among young women who had an induced abortion. By the way, I'm talking about all about induced abortions, not about miscarriages, not about spontaneous abortions, about induced abortions, intentional terminations of pregnancy. Okay, here's one with, they followed up. They did this one retrospectively. They started out with breast cancer patients, and then they went backwards and saw what percentage of them had a induced abortion. And they found that it turned out for women who'd had an induced abortion, the risk of breast cancer was 50% higher. So the first paper was 90% increased risk. This paper was 50% increased risk. Okay, now here's another paper, another 50% increased risk of breast cancer if they had an induced abortion. Okay, so now here's another paper. Does abortion increase breast cancer risk? And this one, done by this researcher named Malcolm Pike, a physician, felt that it for women who had an abortion, there was a 240% increased risk of breast cancer. Okay, so I show you all this so you realize these are major increased risks. These are not small increases in risk. These are big increases in risk. Okay, now what's thought to be the reason? They think that maybe as the estrogen's ramping up and there's rapid growth of the breast, normally in the second half of the pregnancy, there's more differentiation of the breast tissue, and it's thought that that has a protective effect for producing milk rather than just rapid growth. For whatever the reason, the spontaneous miscarriages were not associated in general. There's one paper that were, but in general they were not associated with increased risk of breast cancer usually. The other thing I noticed, and you'll see this all the time in medical research, a couple of earlier papers will come out with strong findings, and then later papers will come out saying zero risk. In my opinion, most of the time these so-called later research papers, in my opinion, in my experience, are usually bogus fakes. They're corporate, or they have an agenda to them to try to disprove something that they don't want the public to know. I'm going to show you in my different lectures how it's easy to trick the public about stuff. So one of the ways is industry will just come along, or somebody who has an agenda, and they'll just fund a paper saying the exact opposite of what all the earlier papers. The further you go back in time, usually the more honest the research. Nowadays, big corporations and big organizations, they own these journals, they own the researchers, and they can publish anything they want. So you got to be very careful about anything that comes out in a modern journal, especially if there's any amount of profit associated with it, or if there is any amount of bias. Nobody's going to say anything that doesn't follow what is thought to be so-called recommended in the modern world, if you know what I'm saying there. So just be aware of that. Anything that fits this agenda will get funded. Anything that goes opposite of that agenda will not get funded. Okay. OCPs, BCPs, birth control pills, have some increased risk of breast cancer as well. So, anyways, I thought that was interesting.